The question is that the proposed expenditure be agreed to, and I call the member for Higgins.
Thank you, Deputy Speaker. Deputy Speaker, medical misogyny is not a term that I learnt in any medical textbook. It's a phrase that I became familiar with only once I became a parliamentarian, and it refers to the inbuilt bias against women that is baked into the medical system. And I was aware of it when I practiced, particularly in women presenting with cardiac symptoms who often presented late, were misdiagnosed and had poor outcomes. But I probably didn't fully appreciate it, and it occurs for lots of reasons. It refers to the denialism that women face when they present with their symptoms, which may not necessarily be textbook. It refers to the silencing and shaming of women. It refers to a lack of appreciation of how women's health issues are often related to hormonal and reproductive phases of their life. And it also refers to, frankly, the poor representation of women, all types of women, ethnicities included, and shapes and sizes of women in clinical trials. Those same clinical trials that lead to the registration of drugs, which then are dispersed to millions of women in the market. And is it any wonder that some women simply don't respond to those drugs, as described in the actual journal articles? It starts at the root. This government has taken a strong focus on women's health. We're really running the ruler over our women's health approach in Medicare. One of those first measures that we introduced was a Women's Health Summit, and that was done, led by Assistant Minister Jed Carney in March of this year. It was very much informed on a survey of 3,000 women around Australia, which demonstrated that 2 out of 3 women experienced a type of medical bias in the health system, a term that we now call medical misogyny. Perhaps the archetypal condition is endometriosis. Endometriosis affects about 1 million Australian women. That's a lot of women. It affects 1 in 9 women, and it takes on average 7 years to diagnose. 7 years, that's extraordinary. Cancers doesn't take 7 years to diagnose, and yet endometriosis takes 7 years. And the symptoms, they're not particularly hard. They're basically symptoms that occur with a woman's cycle. Cyclical symptoms, whether they be tummy bloating or pain in the abdomen or in the pelvis, or diarrhea or constipation or painful sex. And yet it is very, very poorly recognised in the health system. And this is why we have funded 20 endometriosis clinics and pelvic pain clinics right around the country. And I had the privilege of meeting one. I went to each endometriosis and pelvic pain clinic in Ringwood East, a very long way from my electorate, but one that I was really pleased to visit, because what I saw there was multidisciplinary care. There was a GP. It was GP-led, but supported by dietitians, physio, occupational therapists, and they even had an ultrasound on site. And this clinic was overflowing with patients. Why? Because people from far and wide are attending this clinic. I learned that patients from as far away as Traralgon would turn up, often with wads of files, because they had been going from pillar to post to try and get good advice. And they would come, and it was such a relief. Now, endometriosis is a chronic condition. There is no cure for it. But what this clinic offers is a 1-hour consultation. It is bulk billed, it is free, it is walk-in. And the public waiting list to see a specialist for chronic pelvic pain is actually 1 to 4 years. 1 to 4 years to just get in through the front door. This clinic has shortened that waiting time to 14 days. 14 days. And I never met such a dedicated, impassioned group of healthcare workers who were simply asking us for more space. What a good problem to have. They had simply run out of space, and as a result, the GP was working from home, seeing patients. And she wanted an extra consulting room. They had also planned on partnering with a hospital in the area, Box Hill Hospital, Eastern Health, in order to have consultant gynecologists also attend with their doctors. And on that note, we have actually increased the Medicare rebate for women to see consultant gynecologists in order to make it much more affordable and accessible for them to do so. And this is, again, a way that we are ironing out the biases in the system.